barriers, and I should name that underneath each of those barriers is a lot more information, but we did take the information and theme it into 7 barriers. We then moved into recommendations, and you can see there are 14 recommendations that came from our co-design group, and they are listed here, also in no particular order. And Sarah's going to go into that in just a moment and talk about what we did in terms of determining what our next steps were after we had all of this information. Before I turn it over to Sarah, I want to make sure that I note to the group that our consistent communication with our co-designers is of priority to us, making sure that they are invited to continue to participate in this process, and that they're also aware of what it is that we're able to work on right now and what we may need to wait on for the future.
Thanks, Julie. All right, so I will talk about the top solutions and recommendations that we found. And so just a quick background on this. So when we had the final report, we all read it, of course, and then we also took the step of asking our co-designers to review it and provide feedback for us, because we knew we wanted to capture authentically what they were telling us. So after we did receive some responses back, so we incorporated that back into the report. And then after that, we knew we had, these were all important recommendations and these barriers that were identified, and we also knew we didn't have the capacity to work on all of them at this time. And so we went back to the co-designers and asked them to rank or rate their top 3 barriers that they would like us to focus on first. And so they did that. And so from the barriers that they identified, these were the top 4 that came out on top as priority to work on. So that was transportation, relationships, trauma-informed care, and emotional support. So again, we all these recommendations are highly valuable, important to work on. We just have to start somewhere, and this is where we're choosing to start. We also spent some time talking as a project group around the importance of how easy it can be when you're addressing barriers to just go surface level and like, okay, we can fix this, we can fix that, we can fix this. But we really wanted to take a step back and work on figuring out what the underlying cause was of a lot of these issues, and work to address those instead. So I'm going to read a few quotes, and these are directly from the report, and there's a lot more in there, but just to give you a flavor of what these different barriers came up as. So for transportation, here's a direct quote. Transportation to and from prenatal care appointments was difficult because some of us didn't have licenses yet. Relationships, and again, thinking back to what Julie was talking about around the different types of relationships and how these can show up as a barrier. So this person said, there was no one I could turn to at school, no teachers or counselors. I didn't even have a social worker, but I wish I did. For trauma-informed care, providers need to pay attention to how the patient responds when completing exams that require physical touch, like pelvic exams or doing an ultrasound. This could be a sign of sexual trauma and may cause the patient to not show up for their next prenatal care appointment. And then finally, emotional support. Depression prevented me from seeking prenatal care. I was in an unsafe relationship and was controlled and isolated during pregnancy. All right. So for transportation, I'm going to focus now on some of the solutions that were recommendations that came up from the co-designers. So this transportation received the most votes because it was one of the barriers, especially to our younger co-designers and their peers that were accessing prenatal care, that was the most difficult to navigate. So for our younger co-designers, they either didn't have transportation, or if they weren't on good terms with a family member who could provide transportation, it made it really difficult to get to their prenatal appointments, and it was difficult to ask for help. So they talked a lot about offering free transportation to and from prenatal care appointments, and they did acknowledge, while there are insurance companies that do provide transportation that's free, there's a lot of barriers to accessing that, and it can be hard if you want to bring extra people with you to an appointment, or if you have other children, etc., that's for them to accommodate that for you. So one of their other recommendations, and this comes up a couple times, is to be flexible in appointments. And so one of their ideas is to meet virtually with clients, patients for prenatal care appointments as an alternative option. All right, so relationships. So relationships was the second highest ranked barrier to work on. And they talked a lot about how to rebuild or repair relationships to help to start to rebuild trust. And so again, for our younger co-design participants, this could look like not having a great relationship with a parent or caregiver, and that stigma made it really hard to access things going forward. However, they did say that relationship is really important to help repair, and they wanted ways to figure out how to do that. They also talked a lot about education around what a healthy relationship looks like, and acknowledged that, again, for some of our younger participants, that they don't know what a healthy relationship looks like, or there's other factors that are happening, emotional, verbal, physical abuse, etc. And they brought up this idea of having a relationship 101 class to how to communicate in a relationship. Again, what does a healthy relationship look like, etc. And then there was quite a bit of discussion around how to build or rebuild that trust between a patient and the provider. And so here are some of their ideas around some of that. So flexibility in patients seeing the same provider if possible throughout the duration of pregnancy and birthing. Again, creating that collaborative environment for open discussion between the patient and the provider. And then really, as a provider, not making judgments or assumptions about patients or clients and their pregnancies. All right, trauma-informed care. So Julie touched on this a little bit, and the confusion around what this means. So as a patient and also as a provider or an organization. So it's a relatively newish, I guess, term, and so a lot of people have different definitions of what this is. And so co-designers talked about maybe we could come up with a collective definition in our community of what this is and how how this is gonna look when we're caring for patients and clients. They also talked a lot about changing approaches to how care is provided. So offering virtual or phone visits, again, as an alternative option until the client or patient is more comfortable to come into the provider's office. Maybe providing home visits for prenatal care, and talked a lot about using the gender-affirming language in providing care for patients and clients who identify as LGBTQIA+. All right. Emotional support. So here, the co-designers talked a lot about how can we create more support for pregnant people and their caregivers in our community. And they did acknowledge that there already are a lot of resources in the community with supportive presences. However, it can be difficult to access or may not quite meet the need of what they're looking for. So they discussed having maybe more peer or generational groups that kind of understand and acknowledge the specific experience of particular peer groups. They also talked a lot about being flexible in the current support groups that are out there. Can we offer different timing? Can we offer more virtual options? Can we be accommodating to people that may not be able to stay the whole time but still want to participate, etc. So they also, again, some of this mindfulness work is already out there in the community, but how can we access it and strengthen these already great resources out there? All right, I think we're gonna skip this slide, but I will talk a little bit about next steps. And so what we've been doing, we've already started this, is we've identified some priority stakeholders to move this work forward and to actually develop strategies to implement. So that work started happening in, I think, October, and we've been meeting monthly since then. We forgot to update this slide, but we did meet 2 weeks ago, I'm not sure the date. But we will be meeting again in January. So again, we brought some primary stakeholders together. We've been looking at this report, trying to delve a little bit deeper into what the actual underlying problems are, and also talking with this group of what's already actually out there. What is your organization already doing that we can already tag along on? So in January, we hope to bring all that information together from these 4 stakeholder meetings and come up with some actionable strategies that we can start to implement. We also have been inviting our stakeholders back into the conversations. They obviously were a key piece of this work, and we want to make sure that their voices stay strong and present throughout this process. And we've also been sharing our work, so you can see some different areas that we have already shared. Thank you for letting us come today and share our work here. If you have other avenues that you think it might be helpful for us to share this work in this presentation, please reach out and let us know. But we've been communicating a lot with different partners and have had some great responses. And it's been a really wonderful experience. Anything else you want to add, Julie or Sadie, that I missed?
I think I would just add that one of the groups that we have started talking about presenting this work to is working with Rochester Public Schools, counselors, school nurses, and social workers to also present this information, as they may be some of the first folks that connect with specifically our 15 to 19-year-olds and those with less than a high school diploma. So they just understand that these data exist and the work that we're doing around it. So we're working on adding those additional educational meetings to our list of presentations.
Awesome. Thank you all. Hopefully you can hear I had to switch to earbuds. It's getting a little loud here at the government center. Thank you all for joining us today. Does anybody have any questions for the crew? Feel free to chat and or unmute.
And if not, please feel free to reach out if a question comes up later. I think you know where to find us all, so happy to answer questions at a later date.
Great question in the chat. The answer is yes.
Awesome. Well, Sarah, Sadie, and Julie, thank you so much for joining us this morning, and thank you to you all and for continuing to keep the co-designers involved in the project as well. I think that's really amazing work that you've helped lead, and looking forward to seeing what comes in the next few months and upcoming years.
Thanks for having us.
Thank you.
Thank you.
Thanks.
Bye.
Bye-bye.
And if you do have any additional questions, I can be kind of the middle person as well if you need to connect with any of them too. I know all three of them, so happy to connect you along the way as well. All right, so I will spend 10 or so minutes here just kind of sharing a bunch of information and looking ahead to 2025. A brief little look back to kind of where we were at in 2024 within the community health assessment and planning process, and then where we'll be heading next year as well. So always like to have this slide here. I think most of the folks on the call are very familiar with the chat process. Though I just wanted to point out that looking ahead to 2025, the image there on the right, we will be taking a look at all three of those blue circles. So we'll be in the process of assessing our community health, reevaluating those community health needs, and while continue to address our current community health needs as well. So the text on the slide's pretty small, but of course be able to send these out afterwards, but kind of the big picture, there's a larger theme that I'll kind of walk through here with this slide. So there's the two rows there. On the top is our Community Health Needs Assessment, or our CHNA, and then on the bottom there is the Community Health Improvement Plan, or our CHIP. And you can see, starting with the CHNA, both processes are 3 years, so we look at each through a 3-year lens. If you can remember, back in 2021, we completed our community survey for our CHNA. Back in 2022, our full CHNA was released, and that is on our online website format. And then really 2023 last year was looking at maintenance of the overall dashboard, and then the cycle begins again. We just sent out, and I'll talk a little bit more about it in a minute, but we just sent out and are already in the process of working on a couple of different community surveys, and then next year, our next CHNA will be released. Well, in the main theme of this slide is to note that at the same time as our community health needs assessment and getting that ready and wherever that is in the process, we are also working on our community health improvement plan. So taking a look back at 2023, last year, while we were in the middle of maintaining our CHNA dashboard, we were also identifying strategies for what are our current CHIP priorities, access to care, mental health, and drug use. So then looking at this year, this has really been the opportunity for folks and organizations throughout the community to implement the work of those priorities while, again, at the same time, gearing up for our CHNA. And the same will continue next year as well. We'll continue that collective impact approach that we'll touch on more later. So really, again, organizations impacting and addressing those community health priorities while we're at the same time getting our CHNA ready to be released next fall. So again, the main theme here of this slide is that both processes are happening at the same time. So as I just mentioned, continue to move both the CHNA and the CHIP forward next year. So I'll start with the CHIP, and then I will talk more about our CHNA. So looking at our community health improvement plan, again, this is a 3-year plan. So 2024 was the first year of our CHIP, and we'll continue with that collective impact approach. So again, that's really each organization. We have 8 organizations and 3 community groups identifying something or some things that they're willing to do to address one or more of those community health priorities. And then the goal is collectively we'll be making an impact, and residents in our community are better off because of all the different efforts going on to address those priorities. So 8 organizations, 3 community groups implementing 16 total strategies across all 3 priorities. So those efforts will continue into 2025. Some organizations maybe only did a 1-year project and then are each year of the cycle deciding to do a different project. Other organizations have a 3-year project or a project that's continuous. It's totally up to each organization what they prefer. So the number, we'll also look at expanding the number of efforts as well, and potentially partnering with additional organizations as it makes sense. And something to share as well, looking at next month, will be our CHIP annual report. So this is something that we do every year, and this will highlight all of the updates to each of those different strategies. So you'll be able to see where each organization's at, what are some of the highlights, and then what are they potentially looking ahead to doing in 2025. And once that annual report is ready, I'll be sending it out to the distribution list next month. So that is our CHIP. So again, continuing to move those strategies and that collective impact approach forward, and then potentially expanding partnership as it makes sense. And then we will be spending a good chunk of time next year looking at our community health needs assessment, or CHNA. So again, it was last completed in 2022. So 3 years later, here we are next year. This fall, we started the process with our 2 community surveys. Our mailed survey was distributed over the last couple of months. And that is a survey that's statistically randomized and sent out to households throughout Olmsted County. So that is completed, and now we're moving that toward kind of the data cleaning and then eventually the analysis. We also have kickstarted last month and continuing through January our convenience survey distribution. So this one's a little different. It's not randomized. We work with community partners to share this survey out with residents. And one of the other big differences between the convenience and the mailed survey is that the convenience is really focused on lived experience in terms of looking at qualitative data. So even as folks from public health and Julie from Cradle to Career were talking about their prenatal project, looking at some of those stories, and tell us a little bit more about your experience. Maybe we do ask about mental health, their experience with mental health, and then we ask them to share a little bit more, if they're comfortable, a little bit more about their experience. So we asked that around healthcare, those around housing instability, financial security, and drug use. So I think that'll be very exciting to see the results and the themes that come from that survey. So then we have some data prep and cleaning and making sure everything's good to go later this year. And then moving on to next year, the data analysis WinCross, really that means diving into each of the different questions that we ask and pulling what percent of folks responded in a certain way, as well as looking at things from equity lens as well, so looking at various demographics, so maybe those which we report out in all of the CHNAs in terms of maybe those 65 and plus who experience a certain condition, or maybe those who live in Rochester versus live outside of Rochester. So looking at all of those different things. A lot of next year will be building out or continuing to build out that CHNA website, which the website is already built, so it'll really be updating all of those different dashboards with this new data. Next summer, we will go through a prioritization process again, so we have those 3 community health priorities, and we'll be able to reevaluate in terms of if we have, if we make changes to those priorities, if we swap out priorities, etc. And then lastly, our CHNA will be released next October. So definitely a busy year in terms of the overall CHNA and the chip going on at the same time. I think this is the last slide before I can pause here for a minute and for questions. But I did just want to share, I think this is pretty exciting. So looking at our mailed survey, our data subgroup has done an awesome job of evaluating the survey and offering some recommendations around specific questions to add to the survey. So we will have data on a good variety of topics this year. One, looking at adult dental care. We already have the youth perspective, so being able to see adults and when the last time we went to the dentist was. We'll have data around suicide ideation and attempts. We already have data on cannabis use, but we'll be able to know what specific type of cannabis and where they got the product. We'll have data on sexual behavior and use of contraception, on the year a home was built and testing for lead within the home. The second to last one, we ask adults around if they had delayed any types of care. So this could be mental health care, dental care, medical health, medical care. So we ask that for adults if they've delayed any types of those cares. So we're asking if their children, if they have children, have delayed any of those types of care. And then lastly, we're adding a demographic question, asking for that veteran status as well. So that is it for kind of the looking ahead to 2025. Are there any questions that anybody has? Awesome. And if don't remember all of that information, we'll have updates, of course, at our quarterly HAP meetings to see where the CHNA is going, and we'll have some engagement as well. Looking ahead, for example, like in March, in looking at navigating the platform. Are there ways to improve the platform? So at those HAP meetings, we'll be able to share updates on where we're at with both the CHNA and the CHIP, as well as next year we'll be piloting some occasional newsletters for the chat process as well. So being able to share some updates there too. So definitely we'll keep you updated along the way as we continue to move both of those efforts forward. So shifting gears back to our CHIP, or Community Health Improvement Plan, wanting to get your feedback on some non-collective impact efforts. So I'll talk a little bit more about what that means. So we do, as I mentioned a couple times here, have our 3 community health priorities for the next 3 years: mental health, drug use, and access to care. And I mentioned a little bit earlier the annual report, which we're anticipating will be released next month, and wanting to share some updates on those strategies around the collective impact approach. So again, each of those 16 different strategies that I mentioned earlier from the 8 organizations and 3 community groups will be shared within that annual report. However, we know that there are a lot more than just 16 initiatives being done to address these huge complex health issues. And so that's where asking for your help today to help kind of populate that other piece. So what strategies or what efforts other than those collective impact strategies are being done to address these health issues? And we'll include a specific section within the annual report, and we're actually showing, we'll show you here in a second kind of what that looks like right now. So we'll have a section on all of those collective impact strategies, and then we'll have a section on what else is happening in the community to address these health priorities. So Mary Claire will share here. Awesome. It's a couple pages, a page and a half here of non-collective impact strategies. So just wanted to scroll through this and just kind of give you all a brief little some time here to see. And we scroll back up, I can just highlight a couple, and while folks take a look at them. So within access to care, you can see like the Good Samaritan Clinic and efforts being done within public health, the Mayo Medical Center, the Landing, Southeast Regional Crisis Center, the Street Medicine Initiative, WIC. So again, these are strategies that aren't part of the collective impact, but are still being done in our community to address, in this case, access to care. So we can jump down and give you all a preview of the drug use piece as well. So we have Be in the Know, we have the DART team, we have public health efforts, Safe City Nights, RPS hiring drug and alcohol counselors, Collins Grant, with Olmsted Medical Center, and then jumping down here to mental health, Family Service Rochester Resource Center, Fernbrook, yeah, a lot of different community initiatives that you can see there, Family Acceptance Project, etc. So again, these are things that will already be included. So when we pull up the Mentimeter here, we will ask, is there anything additional that you would add to this list? So that one, wanted to give you a sneak peek, and then two, to hopefully limit overlap in terms of things that we include here in the Mentimeter. Yeah, April, I see you have your hand up.
Yeah, so is this the list of the 8 organizations working on the 16 different things, or is that totally separate?
Yeah, that's a great question. This is separate. So each of those different organizations and each of those efforts will be highlighted in more detail. So specifically, what are their goals? What are they working on last year? What are they or I guess last year will be 2024. And then what do they work on the next couple of years? So that is a separate piece to it. So like, for example, public health leading the LGBTQ plus work with a lot of community partners. That is something that's highlighted in that other piece of it. So hopefully that kind of makes sense. And if there is any overlap for things within the Mentimeter that do come up, that's totally okay. We'll have all of the information available and being able to ensure that each of those are included in the annual report. So with that, we'll get started with the Mentimeter. And Mary Claire just dropped that in the Teams chat there, so you can just follow that link. So this first question is specifically looking at access to care. What other initiatives are you aware of related to access to care? So I'll pause here for a bit, allow you all to share any thoughts that you have.
Can you pull the list back up too, or pop it in the chat or something?
Yeah, perfect. I think we can pull up the list here for a little bit and then we can go back. If you want to scroll up Mary Claire to access to care, please. Perfect, thank you. Yeah, so here's the list. So in addition to any of these things here, and then we'll check back in on the Menti in a couple minutes and see where we're at. If you remember something later or anything like that, feel free to just reach out to me directly. We'll get back to you, absolutely. Pause here, see if anybody has any last additional thoughts at this point. And then our last priority here is mental health. So same question around mental health. right, and let's see what folks are saying about mental health. Nothing new added at this point. Give it another minute or so and see if if anybody has anything else to add. No problem. We'll be able to decipher it. And I think some of these two definitely overlap, collective impact and too. So. Awesome. Well, thanks for working through the awkward pauses there, so we gave time to folks to think and self-reflect. And as I mentioned as well, if anything comes up over maybe the next couple of weeks, or if you get back from the holidays and think of something, feel free to let me know. Happy to include that in whichever priority or priorities you would like. So thanks for helping with that. And yeah, I wanted to also give you a little sneak peek as well to that annual report that you'll see in more detail in January. With that, we have core agency updates, and then we'll round out the meeting after this with community announcements. So just going in order here, starting with Mayo Clinic.
Sure, I can do our updates first here. We do have a new website that we'll put in the chat that shows the construction updates that are going on downtown, because I know they're having a major impact on both Mayo Clinic and the community. So we'll put that in there. In terms of contribution efforts, Mayo made more than $800,000 in donations to area nonprofits in the first quarter of 2024 through its community contributions program. This included about $260,000 to programs that improved access to care, $435,000 to programs that support mental health, and $15,000 to programs supporting substance use. We've also made progress with our own collective impact goals, contributing to the Olmsted County CHIP plan. These included identifying more adolescents with mental health needs and substance use disorders, reducing first-time referral waste for specialty care, and screening and referrals for food insecurity. And that's our updates for this. Any questions?
Awesome. Thank you, Dr. Lynch, and Sue dropped in the chat as well, the construction updates website. So thank you for that. OMC is next.
Hi, this is Anna. I'm going to step in for Terry today, so apologies in advance if I'm not as good. I put some of these in the updates into the Mentimeter, but OMC for mental health, we're adding, we've posted for a clinical health psychologist and a child psychologist and child psychiatrist. So that's cool. And virtual group therapy for eating disorders, as well as just general group therapy sessions. And let's see. We're working on ED to MAC clinic transitions of care for our opioid group and collaborating with the jail for MOUD. We're still offering our drive-through vaccine campaigns, and we did a sensory-friendly vaccine clinic. And you noted we're partnering with WIC, and we're going to be offering, when patients are reporting that they have food insecurities, we're going to be able to provide them on site with a box of food at that time. So we're trialing that come this next quarter. So that's kind of our updates.
Awesome, thank you, Anna, and appreciate you jumping in and stepping up this morning. Appreciate it. In public health, and Megan.
Just a few updates. One of the first, kind of hitting on substance use, we've been doing a lot of work around cannabis and prepping for registration. Some breaking news as of yesterday, they're going to be delaying the social equity licensing. We were doing a bunch of our work in prep that that lottery would happen, and that would mean we would be needing to issue registrations in Olmsted County for our licenses for businesses. That has been put on pause till later in 2025. So we're just trying to figure out what that all means. I am going to put in the link in a link for awareness. We do have a cannabis webpage for Olmsted County that just walks through our ordinances and defines a few things and does some Q&A as well. Additionally, we receive funds from MDH to work on cannabis education, and so we'll be getting started on that, looking at doing some education and partnering with schools around curriculum, but also hopefully some marketing, but then also around compliance checks and retailer education will be coming from that. Another thing around mental health, we're really excited. Our Incredible Mind, I'm putting this link in there too. We have now a dedicated resource page for LGBTQIA plus resources that just went live. We're also working on a bunch of toolkits about how organizations can be using Credible Mind. So more to come on that, but that resource just keeps growing and growing and growing. And we know that we don't have everything yet. So if you see something missing, please let us know and we'll work through that. Around access to care, a lot of things going on with that. We are getting ready for the starting of free testing for well owners in Southeast Minnesota as part of the EPA's response to nitrates in the drinking water. Olmsted County will be doing the lab work for that, so we're just ramping up those efforts, and more information will be coming on that. Recently, the Youth Dental Access Coalition got resurrected. It was on pause during COVID, and they're starting to do some great work and starting to identify some. They went through a root cause analysis and things like that. So excited to see that work getting going.